One of the studies that has been spoken about that I'm really intrigued by is older women, women over 70, who have early stage disease may be able to forego radiation so long as they take tamoxifen.
So that is a study that I will acknowledge I'm an author on, so any comments I make should be considered in light of the fact that I am one of the authors.
And I am intrigued by the study.
Yeah. So this is a study that was done, led by the Cancer and Leukemia Group B, and there were other groups involved in it as well. And women over the age of 70 with early stage breast cancer were randomly assigned to receive either tamoxifen alone or tamoxifen plus radiation. And now, with follow-up that extends to approximately 10 years, what we have found is that women who did not receive radiation, they were spared the 6 weeks of daily radiation treatments, they did take tamoxifen, or they were asked to take tamoxifen, I should say, that those women had an absolutely equal overall survival to women who received radiation. There were a small number of women who had recurrences in the breast who didn't receive radiation. It's a number, and I apologize, I can't give you the exact number off the top of my head, but it's a few percent of women more who didn't receive radiation had recurrences in the breast, but those recurrences were dealt with. More women did not end up undergoing mastectomies because of this. The overall rate of breast preservation was the same in the two arms. And most importantly, these recurrences did not seem to lead to a higher risk of mortality.
How many women were in this study?
So there were a total of between 600 and 700 women in the study overall. Not a terribly large study, but at the same time, I think a study that was able to give us the information we needed.
Is the biology of cancer in that woman at that age different than in other age groups?
If you simply look at older women and you compare them to younger women, the biology is a little different. Cancers tend to be somewhat slower growing, and we know that they are more commonly estrogen receptor positive. Mm-hmm. Here, we specifically selected those tumors that were estrogen receptor positive for inclusion in this clinical trial. That said, I think it's important to recognize that among women with estrogen receptor negative tumors who are older, there's no reason to think that the biology is particularly different than younger women with estrogen receptor negative tumors. ER negative tumors are less common in older women than they are in younger women, but if an older woman has one, it probably needs to be treated more like a younger woman's tumor. But I think here, in these women with estrogen receptor positive cancers, and specifically in these older women, adding radiation gave them a slightly lower risk of in-breast recurrence, but didn't give them anything in terms of an added chance of being alive 10 years down the road. And so for an older woman facing these decisions, if her main worry is having a recurrence in her breast and she absolutely wants to prevent that, then by all means, it's reasonable for her to get radiation. But if she says, I can deal with the possibility that I could have a recurrence in my breast, I know it's not going to change how long I live, then it's probably reasonable to forego it, particularly if that woman has some other medical problems that may limit her life. Because in fact, one of the very important findings from this study was that far more women died of non-breast cancer causes than of breast cancer.